Hello, I'm Heydarian and I want to discuss in this video about different roles of hCG from diagnosis of pregnancy to diagnosis of some tumors. Please subscribe me from the below link and be with me to the end. The the chorionic gonadotropin hormone or hCG is a glycoprotein that is synthesized by syncytiotrophoblast cells in the placenta during pregnancy and maintains the corpus luteum and progesterone production in the first trimester. After that, the placenta produces steroid hormones and reduce the role of this hormone. This hormone consists of two subunits, alpha and beta, and its alpha subunit is structurally similar to LH, FSH, and TSH hormones, but the beta subunit is unique. For this reason, the basis of serology tests to determine pregnancy is to search for the beta subunit of the hormone in serum and urine. Beta hCG is measured for diagnosis of pregnancy, determining the approximate age of the fetus, diagnosis of ectopic pregnancy, diagnosis abortion, and following up to cleaning the uterus from the remains of the aborted fetus, fetus screening for genetic defects, and as a tumor marker in the diagnosis of some germ cell tumors. Diagnosis of pregnancy. This hormone can be measured for the first time about 11 days after conception in the blood and between 12 to 14 days after conception in the urine. Normally, the amount of hCG doubles every 48 hours until the first 6 weeks of pregnancy. The level of this hormone reaches its maximum in weeks 8 to 11 and then decreases during pregnancy. About 2 weeks after natural delivery, it disappeared in the serum and is not recognizable. Determining the approximate age of fetus. The amount of beta-hCG teeth together with ultrasound and clinical examination helps the doctor to estimate the age of the fetus and the date of pregnancy. The amount of this hormone can be between 5 to 50 until the 3rd week, and between the 9th and 10th week it reaches its peak between 25,700 and 288,000, and then it starts decreasing so that it reaches between 3,640 and 11,700 in the 25 to 40th weeks. Of course, these amounts are related to when the fetus is a singleton, and in the multiples, these numbers are higher. Diagnosis of ectopic pregnancy. When the doctor wants to confirm or reject an ectopic pregnancy, he repeatedly checks the hCG quantitative test over several days. In these cases, a woman may initially experience normal signs and symptoms of pregnancy, but then may have signs or symptoms that indicate the pregnancy is not progressing as expected. So the beta teeth should be checked serially and repeated every 48 hours. As mentioned, in a normal pregnancy, the beta titer doubles almost every 48 hours. Those who have an ectopic pregnancy, their beta titer is not very high, and more importantly, it does not follow this pattern, and its increase is minor. Uh, diagnosing uh, diagnosing abortion. The doctor can compare the information from the BHCG results with other information in the medical history and check whether there are any signs of miscarriage. Also, the initial ultrasound results are very important. In general, if beta-hCG level drops in the first trimester, this is likely a sign of impending miscarriage. Usually in women 4 to 6 weeks after the abortion, the level of beta-hCG should be the same as the person who is not pregnant. Of course, to some extent, this time depends on the type of abortion. For example, whether the person has a cortage or aborted the fetus with medication or naturally, and how much the level of beta hormone increased at the time of the abortion. Fetus screening for genetic defects. In order to check the health of the fetus, double marker test is performed on the blood of pregnant mothers in the first trimester of pregnancy. This test consists of two biochemical indicators, PAPA and free beta-hCG, in the mother's blood and sonography. The total results of anti-ultrasound, mother's blood tests, and the mother's age are analyzed and interpreted together, and based on the obtained ratio, pregnant women are divided into three categories of high risk, medium risk, and low risk. Those who are at low risk do not need to undergo any other screening or diagnostic test. High risk women are advised to perform placental sampling or amniocentesis, and only moderate risk women are candidates for a second stage screening test, triple marker and quad marker. A triple marker test is a screening test in the second trimester of pregnancy, which is used to assess the risk of Down syndrome, trisomy 18, and fetal tube abnormalities, including encephalopathy. In this test, which is performed in the 15th week and before the 20th week of pregnancy, three biochemical indicators, alpha fetoprotein, free estriol, and beta hCG are measured. The obtained results are analyzed using specialized software, and the level of risk is determined. If the result indicate a low risk, the possibility of the abnormality under investigation is small. High-risk women are advised to undergo CVS or amniocentesis. In order to better interpret the test result, in addition to measuring these parameters, it is necessary to know the mother's age, the mother's weight, and the time of sampling. At the time of sampling, and the mother's clinical problems such as diabetes. Quad marker is similar to triple marker plus inhibin A. So this screening method for biochemical indicators, alpha fetoprotein, beta hCG, free estriol, and inhibin A in the mother's blood are measured. So if the results indicate a low risk, the probability of occurrence of the studied abnormalities is small. High-risk women are advised to undergo CVS or amniocentesis. hCG as a tumor marker. hCG may be secreted by seminomatous and non-seminomatous testicular tumors, ovarian germ cell tumors, gestational trophoblastic disease such as hidatidiform mole, and benign or malignant non-testicular teratomatous. Rarely, other tumors, including hepatic, neuroendocrine, breast, ovarian, pancreatic, cervical, and gastric cancer, may secrete hCG. In tumors, hCG is a valuable marker that can be used to identify and monitor tumor activity. Serial measurement of hCG following treatment is used to monitor therapeutic response in these tumors and will detect the persistence or recurrent neoplastic disease. Thank you for your watching. I hope this content was useful for you. Thank you again and goodbye.